So welcome everyone to the Pankhurst Health Technology Translation Toolkit Introductory webinar. My name is Alessandro and I'm Translational Research Manager at the University of Manchester. I contributed to the development of this toolkit together with Dr. Claudia Linne, Ellie Marianopoulou, Fiona Foster, who is not here with us today. We have an exciting webinar ahead. We have Professor Chris Taylor, who is our AVP for Digital Strategy and Innovation, who is going to tell us a few words about the toolkit and its utility. Then we have Dr. Claudia Linne that will give us a little introduction on the toolkit itself and give us a demo of it. Then we'll have an opportunity to ask questions at the end. And finally, a few closing remarks. So exciting agenda ahead. And without further ado, I'd like to introduce Professor Chris Taylor to tell us a few words about the toolkit and the Christabel Pankhurst Institute. Chris, over to you.
Thanks, Alessandro. So yes, I'm just going to do a very brief introduction. So first of all, about me, I was the founding director of the Pankhurst Institute, and I'm now chair of the Pankhurst Management Board. I'm speaking because Alex Frangi, who's the current director, is traveling today and not available. So I'm just going to say a little bit about the Institute and the context in which the toolkit got developed. For anyone who doesn't know, the Christabel Pankhurst Institute, a partnership. So it's hosted by the university, but it's a partnership with Greater Manchester Combined Authority, Bruntwood SciTech, Health Innovation Manchester, and the Manchester University NHS Foundation Trust. Those were the founding partners. We're in the process of bringing other partners on board. So I think that's a really important point, that this isn't something that's inward looking and just based in the university. The connections out into the health service in Greater Manchester are a really important part of what the Pankhurst offers. We also have a hub building. For anyone who hasn't been there, if you wander around the campus, there's a very bright red building, brighter red than it looks in that picture. That is a hub for Pankhurst activity, and we're increasingly ramping up the number of events that we'll have in there. And if anyone on the webinar is interested in having space allocated within the building, we're currently doing a new space plan. So if you'd like to spend some of your time with other people doing similar things, you better get in touch with me, I guess. Okay, if we move on. So that's what the Pankhurst is. Very briefly, it has a strategy that's been that the new director, Alex Frangi, has developed over the past few months. The really important point is that it's not technology-led, it's challenge-led. And there are 4 challenge areas. So one of them's about population health, improving inclusivity and improving prevention. A second one is around disease prediction and diagnosis. I think those 2 are probably self-explanatory. The third one's around bringing interventions faster and sustainably. So this maybe does require a little bit of explanation. So this is about running trials in silico. So this is about looking at the safety of devices. So I think the illustration here is a stent, without actually having to put anything into patients. So it's simulating what the effect will be in patients. And then the final one is really a higher level one. It's about engaging with our local health system, with the Greater Manchester health and care system, and using technology to make a real difference in our local community. So cross-cutting those are themes in artificial intelligence and digital health, computational medicine and biology, and diagnostic and therapeutic technologies. So that includes materials. So that includes physical intervention, not just digital intervention. The thinking about where the opportunities lie is those 3 points there, around the fact that we have increasingly technological convergence in the healthcare space. We have increasing availability of data and multimodality data and connectivity within the health space. And then around that, around the third challenge, the bringing interventions more rapidly and safely, a whole area of regulatory science and innovation that can bring that kind of technology to market. So that's the Pankhurst in a nutshell. It's about using health technology to drive better health. So the mission there is summarized. It's about using the strength of the university to make a difference in the health system. So translating research into practice, supporting the health technology ecosystem in Greater Manchester, and using through that combination, contributing to making a real difference to health and care in Greater Manchester. So a specific focus, and it's what's really relevant to the presentation today, is on translation, is how we take ideas in the university and get them out in practice into the health service. So part of that, and part of the mission of Pankhurst, is exposing researchers to the real health and care needs, so starting things from the point of real need, and then supporting the translational pathway, and that's precisely what the event today is about, and then moving on from that, supporting commercialization. In parallel with doing things internally for the university, getting university ideas out into the real world, there's also a strong emphasis on partnering with businesses, and working with them to meet business needs, and building long-term partnerships with business. So that's the context. So if I go back to the middle bullet on there, I think the toolkit you're going to hear about today was developed to provide support for the translational pathway. It was developed recognizing that a lot of people working in this space don't really understand the complexities of getting from an initial idea through to something to delivering something in the healthcare system. There are a lot of moving parts, and many ideas currently fall by the wayside because it's all just a bit too complicated to follow things through. So what we hope is that the toolkit will provide a valuable resource for making sure that more ideas get through from the inception stage to real practice.
Thank you, Chris. Thank you for the introduction to the Pankhurst. I think without further ado, I'll hand it over to Claudia, who will do a brief introduction of what the toolkit is about, and then move on into a live demo of the toolkit itself. Claudia, over to you.
Good morning, everyone. So my name is Claudia Lindner, and I'm a Senior Research Fellow and Sir Day Fellow in Translational Medical Imaging at the University of Manchester. And I'm here today in my role as the translation lead for the Christopher Pankhurst Institute. And as part of that role, I am the academic lead for the development of the translation toolkit. And I'm going to show you a demo of the toolkit very soon. But before doing so, I'd like to tell you a bit more about why and how we have developed the toolkit. And Chris already alluded a bit into why it came about to develop this. And a lot of you might be aware that actually, if people are developing health technology within a university environment, it may take quite a long time for these technologies to actually reach clinical practice. And if you look at the publications, there's some numbers out there which say, oh, actually, it takes on average 17 years from something that is being innovated at a university for it to actually be used in clinical practice. And if you look further into this, it's not actually that it's just 17 years, but it's for 14% of those innovations, that translation takes place within 17 years. So that means for a large number of innovations, that might take even longer, or for most of them, I would suspect, they probably don't make it into clinical practice at all. And so there's a huge opportunity here to speed up and to increase the translation of health innovations out of the academic environment into a real-world product. Now, in addition to this time dimension, we've also noticed that in contrast to, for example, drug development, where there's a lot of guidance and information out there in terms of what actually needs to happen to take a drug into practice for the patients to use it, looking at medical devices, that information is a lot more patchy. And what I found from personal experience, in particular with regards to software or digital health innovations, is there is not much information out there at all to put that complex pathway, as Chris pointed out, together. So if you are developing such an innovation and you wanted to take it into the clinic, it's very hard to find out what do you actually need to do to manage that, to get to that final stage. Now, at the same time, certainly locally within the greater Manchester health ecosystem, and I believe also in a lot of other areas, there is support available, there is knowledge available on how to do so, but unfortunately, it tends to be in rather isolated silos to putting the piece together. And so as Dr. Adam Reed, who's a clinical lecturer and honorary consultant in plastic reconstructive surgery, puts it, and he says, the University of Manchester has successfully translated medical devices to the clinic. To improve these successes, it's crucial to establish institutional memory and the knowledge base of the critical stages of regulation leading to translation. And so what he points out here is, yes, there have been people who successfully managed that translational pathway and took innovations from the research stage to an end stage product that is used in practice. However, they tend to work on their own. So each of them on their own trying to put the puzzle pieces together in terms of how could they achieve that? And so there's a little shared knowledge in terms of how can we do that. However, if we want to have successful translation and improved translation, we need to break those silos. We need to share knowledge in terms of what works, what doesn't work, and we need to provide some guidance so that we can make full use of the support that is available and also of the knowledge that is available. Now, who developed the toolkit? The toolkit was developed in collaboration between the Christopher Pankhurst Institute and Translation Manchester. However, we've not done that in isolation. We've had regular feedback from a range of stakeholders to inform the development of the toolkit. And so we had those stakeholders included, for example, academics who had experience in translating health technologies, clinical experts who are active in the innovation space in terms of taking research innovations into practice, industry, who is working in the translational space and supporting other people in terms of making that success, progressing their innovations to a real-world successful product. We've also had input from regulatory experts, health economic experts, innovation experts, as well as from public contributors. And full details on everyone who contributed to the development of the toolkit are available from the Toolkit website. So how was the toolkit developed? And here I would really like to highlight the translational roadmaps, which are a core piece of the translational toolkit, as you will see shortly. And so currently we've got 3 translational roadmaps, one for software as a medical device, one for a medical device, and one for invasive medical devices. And so the bit I want to highlight here is that these roadmaps have been developed as a platform. So what do I mean by a platform? Well, this means that all the roadmaps follow an underlying structure. And so the underlying structure includes a time dimension, if you wish, which starts at the very basic research and takes you through all the stages to having a real-world product that is used in practice. But in addition to that time dimension, we also identified that there are 6 strands of activities that really need to happen to make progression along that pathway successful. And so those strands that we've identified are research and development, health economics and service transformation, regulation, productization and distribution, business model, and health and care evaluation. And so for each of these strands, we've identified activities that need to be considered and acted on independently on whether you might develop a digital health innovation or maybe something that is being implanted in the body. And so we've identified a set of core activities. So for example, for the business model section, that includes to consider intellectual property and branding, the market size, and market share. But there's a whole range of activities for all these 6 strands. Now, based on these strands and those activities there, what happens for a specific roadmap is that we map the activities from the strands to the different stages along the translational pathway. And so we do that to point out for a particular type of innovation, when do these activities need to happen, but also in terms of what does that mean? Because the same kind of core activity might look very different depending on whether you develop some software or an implantable, and I will come back to that as part of the demonstration as well. Now, in addition to that, we think that stakeholder engagement as part of the process is really important. And so to encourage stakeholder engagement, we've also included a stakeholder mapping. So for each of the activities that needs to take place, we make suggestions on which stakeholders to engage with. And again, I'm going to come back with more details on this as part of the demonstration. And so because we have developed the translational roadmaps as a platform, what that means is that this opens up opportunities for additional roadmaps. So in the future, one could think of, for example, having roadmaps for in vitro diagnostics, materials, imaging biomarkers, next generation therapeutics, etc., or following that same underlying structure, but being tailored for the particular health technology. Now, what does the toolkit provide? As you will see shortly, the translational roadmaps will provide step-by-step guides in terms of which activities to take place, but it also will allow you to mark up activities that you might have already engaged with so that you're able to actually progress your pathway for a particular project along that translational roadmap to identify maybe areas that you still need to focus on to make it successfully to the end stage. In addition to, for you to provide some guidance on how to do things, there's an extensive resource database which links back to the strands of activities and provides a whole range of information for you to find out what does a certain activity mean, what could you do about it, and maybe even who you could contact with regards to this. And this is further strengthened by a support network that highlights stakeholders that can help and support you with particular activities along the pathway. And to provide some learning and insights from people who have successfully gone through this process, we are complementing the toolkit with a number of inspiring case studies. Okay, so let's have a look at the toolkit. So this is the landing page of the toolkit, and it can be accessed via translation-toolkit.manchester.ac.uk. You will see on the landing page there's a summary on the features that the toolkit provides, but what you will also notice is at the top right, there's a University of Manchester login button. So what does that mean? The toolkit in general is available to everyone, so it's open access. However, there is the opportunity to log in, and that means that, for example, with regards to the support network, for people within the Greater Manchester Health ecosystem, there will be specific contact details of people to contact to seek that support. And so if you wanted to use it, you just click on there, you put in your university username and log in, and then you get access to those additional details. However, I'm not going to do this now because I don't want to include any access restricted information as part of the recording. So we've already heard that the roadmaps are a core part of our translation toolkit. And I mentioned that, excuse me, I mentioned that we've got 3 different roadmaps on there at the minute. So if I click into one of these roadmaps to start with, what that will do, it will load up what we call the map view. And so we've got 2 different views for each roadmap. The map view, which is really good for you to browse through the pathway and to identify what are the different stages, what are the different type of activities for the type of technology that one is developing. And then we've got the list view, which is the most interactive component. And so as part of the demonstration, I'm going to show you both, but I'm going to start with the map view. And so as you can see at the very top, we've got our little roadmap, and we've got 8 pins on there, which represent the 8 different stages. And at this point, I'd also like to mention on why we are referring to it as a roadmap. So even though it looks a bit like a linear road with all the 8 stages, and all the 8 stages need to be completed, what is the case quite often is that it's not actually a linear pathway. So someone might have to take diversions, you might have to take a road back and get back to stage where you have been previously, and to represent that it's not always a linear process, that's because we adopted the roadmap approach. But what you can do is you can choose any of these stages. For example, if I choose stage D1 is the very first basic research stage, you can see 2 of our strands coming in here. And then for each of the stages, we also got some suggestions on potential funding sources, who to approach to seek funding, and also deliverables to achieve as part of that stage to successfully progress. Now, D1 only's got 2 of our strands. If we click on a more advanced stage, D3, for example, we now have got 5 of our strands, and if we click at T1, we can see all the 6 strands that I mentioned before being represented. Now, as I mentioned, for each of these strands, we then got a set of activities, so you can open these strands and you then get the list of activities that you should be looking at in that particular stage. And so that is tailored to the particular roadmap. So for example, if we look at R3 as the core activity is around quality management and having a quality management system. And with regards to the software medical device roadmap, this includes information on and standards on developing such software for clinical contents. However, if you were to look at R3, for example, in the invasive roadmap, R3 would look quite different, and it would refer, for example, to activities around sterilization. And so that's what I meant with regards to that the activities are tailored to the type of roadmap that we're developing. So even though the core is the same, it's tailored and providing context and also wording that is more appropriate for the particular roadmap. Now, in addition to the description of the activities to take place, what you will notice is a couple of icons on the right. Now, the first icon, the kind of stop hand icon, is our dependency icon. And so that doesn't appear for every activity. It only appears for activities where there is a dependency. And it just means actually before you can successfully complete R4, you will need to have a look at R&D 4, R&D 5, and R&D 6. So you can go up to the R&D activities, and then you get an idea what is R&D 4, 5, and 6 about, and focus on these before you can make sure you can complete your R4 activity. Now, the second icon is an icon that appears for every activity. It's our people icon. And so that's the stakeholder mapping that we have done for each of the activities. And with regards to the stakeholder mapping, we've identified or included 3 different types of stakeholders. We have stakeholders where we suggest you definitely have to involve them as part of this activity. We have stakeholders where you may or may not involve them as part of a particular activity, and that very much depends on the type of technology that you might be developing. And then we also got a third category where we say, oh, these are the stakeholders that you don't actively have to involve, but you would want to keep them informed about what you're doing at this particular stage. And so this is the map view. As I said, it's really quite a condensed view, providing a lot of information in terms of finding out what are the things to happen, who are the people to approach. Now, if I move to the list view, again, you get from the roadmap perspective, you get the same information. This time it's sorted by stage. So you get your 8 stages, and then you can click into the stages and you get your different strands, and for each strand, you get the activities with the description. But the difference in the list view is that you've got checkboxes. So you could, for example, say, okay, for the project I've currently got, yes, I've done that basic research. I've also started looking into the business model activities, and I've also completed my first stage, second stage. Yeah, I might have also already completed the research activities. You might have identified the health and care application that you want to go into, but maybe you've not really completed everything around ethical approval and data governance, and potentially you've not actually spoken to someone about is there an opportunity for patenting the innovation that you're developing. And so in terms of deliverables, you got an understanding of your health and care setting, you looked at the literature as part of the R&D activities, but you've not initiated any IP protection. And so you can take this off, and what you can do then is you can save this information as a project. So there's a button, Save Current Project Locally, and you could call this, let's say we are developing maybe an AI tool for breast cancer detection. So you can save that project locally, and it will appear down here. And so if I now were to change things, you will see it updates the time, so it saves that information, and you can create multiple projects. They all can have different activities or deliverables already been done. They will all appear in this list, and all you need to do is you need to load the particular project that you want to update. Now, one thing to point out here is that this information about the projects is saved locally in your web browser. So if you were to go to a different computer, or if you were to use a different browser, that information wouldn't be there. However, to make that information a bit more permanent as well, what you can do is you can export this information. And so there's a couple of features, if you scroll down on here, where you've got a checklist PDF and a full roadmap PDF. And for both of these, you can choose whether you want to include the deliverables and the funding sources, or whether you might just want to focus on the strands and the activities. And so the checklist PDF is a PDF document that includes the tick boxes that you've chosen. So it lists all the activities, and exactly the tick boxes that you've chosen on the left will appear in the document. The full roadmap PDF is an opportunity for you to just export the whole information that is in a particular roadmap. So for example, the software's medical device roadmap or the medical device roadmap. So you can just export all that information, and so you can look at that offline without using the web browser. Now, going beyond that and able to track your progress in terms of how well you're doing with achieving your activities, there's also what we call the progress tracker. And so you can click on, for a loaded project, you can click on Show Progress Tracker Report, and that will open a web page where it shows you for D1 in this particular case, we've completed it all the activities and all the deliverables. D2, we've done some activities, we've done some deliverables, but we've not completed it. And that's why the tool concludes that you're currently at stage D2, because that's the first stage that is not complete. Now, in addition to open that as a web browser, if you wanted to include that information, for example, as part of project documentation or potentially as part of a funding application going forward, you could also export the progress tracker as a PDF document. I think I need to load the project, and then you do the progress tracker by PDF. Say get PDF. And then it generates a PDF document with that same document on the web page, but so that you can save it. And what you will find at the bottom of the progress tracker, so once all the stages are covered, there are suggestions on the additional activities and steps that you still need to complete to progress your toolkit along the translational pathway. So these were the two views for our roadmaps. So the next item in our toolkit are the case studies. And here we currently have got 6 case studies on 2 case studies for each type of the medical devices roadmaps that we've currently got. And so once you click into this, what you will get first a summary of the innovators and the innovations that are covered in these case studies. One thing to point out with regards to the software as medical devices case studies is that those 2 case studies here aren't actually regulated as a medical device, because as part of going through the roadmap and the activities that need to take place with regards to regulation, it was identified that currently at this stage, a medical device approval is not necessary. However, all the other strands and activities still need to take place to get to that stage for having successful innovations at the end. And so for the software as medical devices case studies, we've got Professor Emma Dunmore and Professor Tara Gastim talking about their innovations. They're introducing them based on their experience. They're providing some advice in terms of maybe things that they think are good to do or maybe not so good to do. And then at the bottom, we have a number of topics where both Emma and Tarek comment on. And so there's a short summary for each of those topics, but then there's also an audio clip where you can listen to Emma and Tarek commenting on those topics. And so all you would need to do is you click the play button and the audio will play. And those audio clips are extracted from a podcast. So we've actually recorded a whole podcast with for all our case studies, and they are all going to be made available via the Pankhurst Institute Healthcare Matters podcast series. And I'm very pleased to announce that the first podcast, which is the one by Emma and Tarek, is now available. So please feel free later on to follow the link and have a listen. And the other 2 case studies will be released in the near future. But even ahead of the other case studies being released, you will still be able to access the audio clip extracts as part of the case studies that we have included on the Toolkit webpage. The resources database is the place that you would go to if you want to find out how to do certain things. And so here we've got our 6 strands, but we've also got a general section where you might get additional information on funding or standards for medical device development. And for each of the strands and the types of activity resources, there's a whole range of different resources available. Some resources might be PDF files, some resources might link you to other external websites, some resources might link you to internal websites, some resources might link to recordings of previous webinars or other training material for you to access. And the resource database has a search function to make that a bit easier for you to identify what you might be after. So for example, if you search for IP in the search box, you get a list of resource items where IP is mentioned. and then you can just click on them and it takes you to the resource database in that space on where IP is mentioned, so you can look at it in more detail. Now, you noticed earlier on, I talked about the University of Manchester login button. And now when you look at this page here, you can see some of the resource items have a link and others don't. And so this is where the login is relevant. And you will notice a lot of them will say University of Manchester. So some of these information is restricted access for University of Manchester members only. And so once you're logged in, you will get the access details for these additional resources as well. For people from outside the Greater Manchester ecosystem, there's still a whole range of other resources available which aren't restricted to the University of Manchester. And for each of the resource items, you get a short description what it's about if you click on the eye icon, which by default we've decided to hide to make it a bit easier to identify what kind of resources there are. Now, if you find, oh, actually, this resource isn't up to date, maybe because you've been involved in a resource and you've updated it, or you are aware of an additional resource which would be useful, then you could use that chat button here and you could let us know. Just so you don't, it can be anonymized, so you don't need to provide your contact details, but you can if you wish to be involved in future conversation about it. And then you could just let us know any comments that you have on it. And so if you use that icon next to a specific particular item, we will be notified that it's with regards to a particular item. So that's really helpful if you already identified a particular comment. But if you just got a general comment where you're not sure whether that's included or you've got a suggestion for something to add, you can also use the general resource database comment. And again, a box pops up where you can put in your comments that you have for us to include. And so the idea for the resource database, it's really a live space. So it's still being updated. There's still additional resources being added. So whenever we become aware of new resources being released by anyone, really, we tend to add them. So it's a very live resource to provide support. The definition sections provides you just a short summary of some useful glossary terms that are used within the roadmaps, and it also gives you an explanation of the different types of stakeholders that we have included in the stakeholder mapping. The support network, so that's where you get some information on who you might engage with, who you might want to contact to provide some additional support for a particular activity. And so we've structured the types of support into different categories. But if you click on any of these categories, what will happen, you get a list of different items, different support stakeholder items. And some of these stakeholder items will have a Manchester University logo. So that means that support is mainly directed at members of the University of Manchester or the Greater Manchester Health and Care ecosystem. But there's also, again, a whole range of other support stakeholders that don't have that icon that provide support for everyone, no matter where you're coming from. And for each of the support network items, you get some information on how that stakeholder would be able to support you and also at what stage you ideally contact them. And then there's some general contact information on how to approach them. So again, if you're logged in, a lot of the University of Manchester items will have some hidden contact details. So once you're logged in, you might actually get a name and a specific email address or even phone number of a person to contact to speak about this. But even for the more general, there are some contact details that we've provided for you in terms of how to approach us, who to contact to discuss a potential support with regards your activities. And then the final item is the About page, and this is where we just acknowledge who has contributed to the case, to the toolkit in various ways, as well as the funding, which has mainly come from the Wellcome Trust as well as the Royal Society. And so that concludes the demonstration of the demo of the toolkit, and I'm handing over back to Alessandro.
Thank you, Claudia. That was a very comprehensive overview of the toolkit. I hope people found it useful. And